Good morning, everybody. Welcome to day 2 of the 2021 Kids Brain Health Virtual Conference. I am so excited to be back with you for day 2. I'm your host, Dr. Jody Carrington. I am a psychologist and a mom. I've written a few books about kids, and I am just so excited today. Yesterday was phenomenal, but I cannot wait for you to see what we have in store today. I'm going to spend today, the whole day with you as we celebrate this year's theme, realizing change through partnerships and research innovation. You know, the big thing we talked a lot about yesterday was partnerships with the people and the families that we serve, partnerships in research, partnerships in organizations within our communities as we work to move our research into practice. And I have to tell you, the fundamental theme that went through yesterday was all about relationship and connection. Because so much of this work that we do really comes down to this idea the human soul, doesn't want to be fixed or saved. It really just wants to be witnessed. And when you are acknowledged, you rise. I loved, our start yesterday with Dr. Paige Church was really about this idea of, if you missed her talk yesterday, you can watch it again. She was the winner of the Fraser Mustard Lecture Award, had a lot of conversations about ableism and bias as practitioners. And if you missed any of our sessions yesterday, including Paige's talk, paid registrants can rewatch on our YouTube channel later this month. KBHN will send the link right to your inbox. And in terms of our sponsors, always such a big thank you to our sponsors for their support for yesterday. Of course, Simon Fraser University is the platinum sponsor. The Canadian Fetal Alcohol Spectrum Disorder Research Network, CAN FASD, is a silver sponsor, as was Queen's University of Health Sciences and the Israeli Foundation. Our bronze sponsors are CHIO and the Family Institute of BC. And our supporting sponsors is our CASDA and the hospital, of course, the Kids Rehabilitation Center, the Holland Blue Bear. I just know that we couldn't do any of this work without the amazing sponsors that we have on board. And today, we were just chatting before we went live. You're going to meet, there's many of us coast to coast today. We have Elder Syexwaliya, who will join in BC. We have Dr. Chambers in the Maritimes. I'm nestled very, very gratefully here on Treaty 7 land, which is home of the Blackfoot Confederacy, which is made up of the Siksika, the Kainai, the Piikani, the Tsuut'ina First Nation, and the Stoney Nakoda First Nation, and the Métis Nation Region 3. It is our honor to bring this day to you across the many lands that we are so grateful and honored to be joining you from. The overview of today's session is, all I got to say is buckle up, because this idea of hashtag how not to do patient engagement, really a takeoff on this hashtag that was started on Twitter. We're going to step into some of those conversations. You're going to see a trainee lightning talk. We did this yesterday where we have a lot of students doing their research and really just in this very quick 3 minutes talk to you about all the phenomenal innovations that they're working towards. So that's a part 2. We also have the part 2 of our poster session. Better Together 3, again, in this theme of partnerships. We're going to talk a little bit about the Secret Agent Society community. You don't want to miss that. And I also have to tell you, I think that there is going to be so much conversation that will just really be about our partnerships. The Better Together 4 is the Infant and Early Mental Health Resource Hub. And then, of course, Dr. Christine Zime's closing note will be something you want to stay certainly for the whole day. Now, I think that for the most exciting, well, this is actually not the most exciting thing, but I'll tell you, the gamification access, there's this aspect, I don't know if you saw yesterday, but there's codes hidden throughout our platform and you get points. Now, yesterday, there were so many people that were phenomenal. All the prizes were gone by 8. Now, I understand we are a competitive bunch. You give me the opportunity to win a Starbucks card or an iPad, and people were finding codes everywhere. So the beautiful people here at KBHN have said, you know what, we need more prizes for these amazing souls. So They've vamped up the prizing vault again. There's codes now everywhere. They're going to release them throughout the day. So you want to stay tuned in this gamification aspect, because what's going to happen, I think, is really there's more phenomenal prizes available today. And I can't wait for you to win some of those. And you better watch it, because I am also playing right along. I have the honor this morning of introducing you to a phenomenal knowledge carrier. I had some opportunities to speak with Elder Syexwaliya this morning, and her sense of humor, her light just shines right through the screen. She is here to offer us from the Squamish Nation a blessing and a welcoming remarks. Elder Syexwaliya, it is my honor to sit with you this morning. Take it away.
Kayachton, I welcome each and every one of you today to the KBHN gathering. And sounds like you had lots of fun yesterday and lots of interesting discussion and learning. And I just welcome you to the ancestral, traditional, territorial lands where you live, work, and play. I am Syexwaliya from the Squamish Nation, and I'm a mom, a granny, and just got kittens, so I'm a great granny now. And I'm going to my grandfather, late grandfather, taught me we all have an inner energy. My Coast-Salish elders, we believe that we have an inner energy, and that we receive energy from Creator through the top of our head into our energy and from the ancestors, and that we send out that energy to each other and receive from each other. So you can't have your arms crossed, your hands like this or this, because then you're blocking your energy. So I just, let's do some Tai Chi and yoga breathing now. And I just ask you to open your hands, put them in your lap or on your desktop or wherever, and just relax and take a few breaths to ground yourself. And I'm going to sing Syexwaliya's song, Greeting of the Day. And while I sing it, I ask you to Unchomo, in unity. Let's come together as my grandfather taught me. Everyone prays to a higher power by many names. We respect each other's ways, and to pray to Creator, ancestors, and for each other while I sing. Then I'll do the prayer, and then I'll turn it back over to Jody when I'm done. Oh, oh, hey, oh, oh, hey, oh, hey, oh, oh, hey, oh, hey, oh, hey. Ah, eh, ah. Oh, 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 eh, oh, oh, eh, oh, eh, oh, oh. Oh, hey, oh, hey, oh, hey, ah, hey, ah. Oh, oh, hey, oh, oh, hey, oh, hey, oh. Oh, hey, oh, hey, oh, hey, ah, hey, ah, oh, oh, oh. Oichaka. Chen Quen Mentomi Kakakanak Chasiam Yonsionso Tanoi up in Manman Squall and Disquals Deceits Yonsion Manman Equato Chet Yop CII Chet Yop Okameo Chet Yop Squall and Disquals Deceits Asking you, Creator, to watch over and guide all your children today and help all of them and their families, their friends, and the villages where they're from, communities where they're from, and also where they now live, work, and play, and put a shield of protection around each and every one of them, and help in the days going forward to be protected, and help them with their Shkwalwin, the feelings in their hearts and minds, their emotional, mental, physical, and spiritual well being and health. Asking you, Creator, to guide all your children today, especially all the presenters, and help them with their snachum, the words they're going to share, and that we listen to respectfully, and that we transfer knowledge and information and share experiences and be able to create positive solutions for the present and future. Asking prayers for all our family and friends who have serious illnesses, injuries, um, anxiety, depression, those who have had waiting for surgery, had surgery, and the many other illnesses that there are, that you hear our prayers for their health, healing, and recovery. Hear our prayers for all our family and friends who have traumas and battle alcohol and drugs, whether prescription or illegal, because the toxic supply of illegal drugs is taking many across the country. So, asking Creator to hear our prayers to keep them protected and safe and help them with their Shkwalwin for healing, and that hopefully their prayers help some of them find the healing path to wellness and recovery. Asking prayers for all our family and friends who have lost loved ones and are saying farewell to their loved ones, going home to Creator and ancestors, and that our prayers help hold them up in the days ahead as they say farewell and in the healing days afterwards. And always remembering Creator and ancestors that our loved ones who go home and to the Creator worry about us on our life journey that we still have to walk. And so there are guardian warrior spirits, and when we're low in our Shkwalwin, they'll send us signs, maybe a hummingbird, dragonfly, eagle, raven, song on the radio, something that lifts up our heart and makes us smile. That's them letting us know that they're with us and we're not alone. So always know that they're protecting you as best they can. Game Creator, let today be a yet one haltzates up. Let today be an excellent work and lots of learning and fun. Toma Quetzi Snachum, those are my words. Chen Quinman me up. I'm grateful and thankful to all of you for letting me join you this morning. Back to you, Jody.
Oh, Elder Syexwaliya, thank you. I felt that in my soul. Your words are so beautiful. And this idea of, everything that you said about we look after us, that we can't do this alone. We are all on this journey together. Thank you so much for those sacred words. Such an honor to sit with you this morning. We will now, dear ones, we have some greetings from Carla Qualtrough, who is the Minister of Employment, Workforce Development, and Disability Inclusion. She is a decorated Paralympic swimmer and a dedicated volunteer. Carla?
Hello, everyone. Welcome to the Kids Brain Health Network annual virtual conference. The theme for this year of realizing change through partnerships and research innovation is timely, and I want you to know that you can count on the Government of Canada to be a strong partner with you in achieving this goal. En tant que ministre de l'Emploi, du Développement de la main-d'œuvre et de l'inclusion des personnes en situation de handicap, je suis fière que notre gouvernement tienne compte du point de vue des personnes en situation de handicap dans ses processus décisionnels. The COVID-19 pandemic has highlighted the unique and heightened challenges faced by persons with disabilities. As our economy recovers, the government is staying true to its longstanding commitment to build back better and leave no one behind. The Accessible Canada Act and its principles of inclusion are key to this process. as are the Disability Inclusion Action Plan and the upcoming Canada Disability Benefit, which has the potential to improve the lives of the hundreds of thousands of persons with disabilities in Canada currently living in poverty. Also, let's not forget about our investment of $100 million over 2 years under the Enabling Accessibility Fund to help remove barriers in the built environment, and our targeted investment of $29.2 million over 2 years to support childcare centers as they improve their physical accessibility. Nous continuons aussi de travailler de près avec les provinces et territoires et les principaux intervenants afin d'élaborer une stratégie nationale sur l'autisme. Je suis ravie de continuer l'important travail que nous avons étamé afin de garantir un meilleur avenir aux personnes en situation de handicap partout au pays. I want to thank every one of you for all the work you do for children with neurodevelopment disabilities and their families. Together, we can address the significant challenges of the future with a spirit of innovation and hope. Have a great conference.
Minister, thank you so much for those words. I'm so grateful you could join us and these amazing people here today. Up next, buckle up, my friends. I have long known of the work of this phenomenal psychologist. Dr. Christine Chambers is a Canada Research Chair in Children's Pain and Killam Professor of Pediatrics and Psychology and Neuroscience. She is also the scientific director of a national knowledge mobilization network, Solutions for Kids in Pain, called SKIP. Today, she's going to bring us some incredible opening remarks, and I can't wait for you to hear them. Over to you, Dr. Chambers.
Thank you, Jody. Good morning and welcome everyone to the second day of the annual Kids Brain Health Network conference. I'm joining this morning from Halifax, Nova Scotia, which is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq. I'm grateful to live and learn here. And I'm really delighted to be here this morning to offer a few welcoming remarks in my role at the Canadian Institutes of Health Research's Institute of Human Development, Child and Youth Health. I have fond memories of attending the last in-person meeting of the Kids Brain Health Conference that was in Ottawa in December of 2019. And I'm just so pleased to see that Kids Brain Health has continued to find ways to meet and engage and learn from each other during the pandemic. The theme of this conference is realizing change through partnerships and research innovation. And anyone who knows me knows that I am a passionate believer in the power of health research to improve the lives of Canadian children and families. And I believe the two parts of your theme that you're emphasizing, the partnerships and the innovation, are just two critical kind of ingredients to be able to really make that difference we all want to make through research. So the theme of your meeting really does resonate with me. I often say that nothing great is ever accomplished alone. And in my view, the best way to bridge the gap between scientists and the public and patients is to directly engage the public. So that would include patients, children and youth, families, and others in health research. The Kids Brain Health Network and really the whole program and content of this meeting, are stellar examples of how patients, families, researchers, clinicians, policymakers, and other key stakeholders can and must work together to create knowledge and improve health for children and families. It's this kind of partnership and collaboration, working together, finding synergies, that's really going to move the needle for children with disabilities. And I also want to say a few words about innovation. I don't think we talk about this enough in the research space. I mean, we throw the word around a lot, but we don't really unpack what it means. We often hear the word entrepreneurship when referring to businesses and startups, but I really like to encourage research networks, researchers, and organizations to reflect on intrapreneurship. So what do I mean by intrapreneurship? I mean harnessing that entrepreneurial drive, but within an existing organization or network to foster new ideas and creative thinking, to give researchers a problem-solving edge to succeed in an ever-changing world. And there's been a lot written about what happens to companies or industries that fail to kind of innovate from the inside and harness their entrepreneurship talent. They often go out of business or are replaced by others from the outside who've had the freedom to innovate. So to stay relevant, research organizations and research networks really do need to empower their members. And I mean all their members, their rebels, their trend spotters, their communicators, to find and implement new ways of doing research and making impact. And sadly, in traditional research and academia, these individuals, your rebels, your trend spotters, your communicators, are often pushed aside. So we really need to think about how do we create space for these individuals to be heard and to lead? And how can we develop research environments that allow creative thinking to reimagine current norms and structures and develop a culture of entrepreneurship in research? So some of the topics that you've been tackling at this meeting, I listened to Dr. Paige Church's powerful presentation yesterday about ableism in medicine, building respect and eliminating stigma in healthcare. Also the session on stakeholder engagement, processes to guide policy development. These are all really important and brave conversations that highlight the need for partnership and innovation in the work that the network is doing. In terms of what I've been busy doing over the last year at the Institute of Human Development, Child and Youth Health at ITSE, last year we did join forces with colleagues at Children's Healthcare Canada, the Pediatric Chairs of Canada, and UNICEF Canada to engage a wide variety of stakeholders across the country to find evidence-based and community-led solutions for children, youth, and families in our Inspiring Healthy Futures initiative with the hashtag #WeCanForKids. And a number of your network members participated in our engagements. And if you've not had a chance to read the full report from our Inspiring Healthy Futures initiative, I'd really encourage you to check out our website at inspiringhealthyfutures.ca. Through our extensive engagements from September of 2020 to March of 2021, and through the powership of partnership and innovation, we identified 5 key priorities for systemic change to envision or provide a new vision for Canadian children, youth, and families. At the center of these priorities is mobilized communities around children, youth, and families. And I know this is exactly what you have at Kids Brain Health and where you center your efforts. Moving around this center, we had 4 other key priorities: impactful research and knowledge, child-centered policies and structures, schools and communities as health and well-being hubs, and accessible and adaptable health and well-being systems. And so this framework is really helping us to continue a national conversation about the importance of health research in improving the lives of Canadian children and families. And the work of Kids Brain Health very much aligns with this vision. And thanks to this collaboration, we were able to quickly mobilize a new funding opportunity aimed at better understanding and mitigating the impacts of the pandemic on children, youth, and families, including children with disabilities. And this collaboration served to secure significant new federal funding that would not normally have been allocated or dedicated to children. So we look forward to sharing the results of this funding opportunity with you soon. And for those of you who aren't familiar with the Canadian Institutes of Health Research, CIHR is Canada's federal funding agency for health research. And as a scientific director, I'm proud to lead one of 13 institutes, each with a different health research focus or population of interest. We collaborate with partners and researchers to support discoveries and innovation that improve our health and strengthen our healthcare system. In February of this year, CIHR launched a 10-year strategic plan, a vision for a healthier future. Throughout extensive public consultation, the largest ever at CIHR, 5 priorities were identified. And these include priority A, advancing research excellence in all its diversity. And we'll accomplish this by championing a more inclusive concept of research excellence, supporting strong research teams, promoting open science, and enhancing national and international collaborations. Priority B is strengthen Canadian health research capacity, and this will be accomplished by strengthening investigator-initiated research, promoting equity, diversity, inclusion amongst researchers, and enhancing training and career support, as well as CIHR's rapid response capacity. Another key priority is accelerating the self-determination of Indigenous peoples in health research. Priority D is pursuing health equity through research. And I think this is a place where Kids Brain Health really naturally aligns in that we are working to champion research on inequitable health outcomes, access to healthcare in Canada, and determinants of health, and driving progress on global health research. And the final priority area within the CIHR strategic plan is integrating evidence in health decisions. And as someone who cares deeply about knowledge mobilization and implementation science, which I know is a major focus for your network moving forward, we'll accomplish this by advancing both the science and practice of knowledge mobilization, maximizing results for Canada, and strengthening Canadian health systems through innovation. There's that innovation word again. So we at ITSE will soon be looking to you, members of our research community, to help us find the intersect between the Inspiring Healthy Futures Initiative and the CIHR strategic plan. And we will soon be launching a survey that we hope you will all take time to complete. And if you're not already following our ITSE, Institute of Human Development, Child and Youth Health Institute on social media, please follow us on Twitter and be sure you're receiving our monthly e-bulletins where we provide updates on all our activities. Innovation in research and leveraging partnerships to support and promote research outcomes is absolutely critical to moving through the current pandemic, as well as managing and optimizing what comes next and the next wave of research that's going to be needed to support children with disabilities and their families. Again, as a firm believer in the power of partnerships to expand the reach and impact of health research, thank you again for the opportunity to provide a few remarks this morning. I wish you all the best with the rest of your meeting and the very important research that you're all engaged in. I wish you the best as you continue to learn with and from each other, making space for different voices and different perspectives, and congratulate you on all your achievements to date. Thank you.
Wow, we're just firing on all cylinders here this morning. I got to tell you, Dr. Chambers, that was amazing. I got to, it reminds me when you speak about this of a Ram Dass quote. He said this: "We are all just here walking each other home." And when we talk about this relationship and connection with, combining research with practice and our partnerships and being innovative, calling people into this idea of entrepreneurship and research, you're right, that isn't something we talk a lot about. How do we really look for all of the places? This idea of inclusivity, and I think really doesn't happen when we speak about it in research. And so I love that take when we open for today. And thank you so much for all of your work, for your continued efforts for kids and families, and for leading so many of us who totally work.
Thanks, Jody.
Yes. All right. Now we are now heading right over to a bit of a 5-minute transition. And I want you to again back at the site. I want you to take a look at the gamification site. I see Jill Zwicker is leading on the leaderboard with 7,350 points. Jill Zwicker, I am coming for you. So you look for the codes hidden everywhere throughout, and there's big prizes available for you to win. I want you to check out the poster sessions and the networking sites and all of the things that we have in store for you today. At the end of our 5-minute break, we are going to click back onto the next session, which is how not to do patient engagement to building back trust, envisioning the future in partnership and engagement. So the tab is in your feed loop bar on your left-hand side. So when you're ready after this 5-minute break, just click it and it'll take you over there. Stand up, get a coffee, and join us back in 5 minutes.